So when people ask me what is it that I do, I tell them in my work what I try to do is I try to get stuff to people. So you don't need a PhD in political science to get stuff to people, you just give them stuff. Then I tell them, this is really the question that I'm interested in. How do you deliver vaccines to children living in a slum like this? We know that vaccines can save lives. We know how to make vaccines cheaply. In fact, in some cases, we even know how to provide them for free. We know that vaccines will have a disproportionately positive impact among children who are of the poorest of the poor. And yet we really don't know how to deliver these vaccines to people, to children living in slums like this, because if you've ever spent any time in a slum, you will know that it's a physical maze. If you are a child living in a slum, chances are you never had your birth registered, which means that you probably don't have a birth certificate, which means that then you don't have access to the health system, which is how we deliver vaccines. If you're a child living in a slum, you probably don't go to school regularly, which is how we deliver vaccines here in Canada. And if you live in a slum, you probably don't have an address. So these are the kinds of questions that vex me in my work, because we know what we need to do, but we don't know how to get it to people who need the most. And if we're serious about the Sustainable Development Goals, if we're serious about eliminating poverty in all its forms everywhere, then we have to figure out how to get those vaccines to children living in slums. Now, the backdrop of my work, of course, are the Sustainable Development Goals, the SDGs, which were just signed in 2015. But as we look ahead to the SDGs, it probably makes a little sense to look retrospectively at their predecessors, the Millennium Development Goals, or the MDGs, which were signed in 2000. Now, the MDGs, by most measures, were an extraordinary success. Countries around the world improved health outcomes, education outcomes, poverty outcomes. The MDGs sparked a whole generation of innovation, new partnerships between governments, private sector actors, partnerships between the government and the market. The MDGs were the era in which terms like social innovation and social entrepreneurship became mainstream. But the MDGs were not an unqualified success. Because when you actually begin to disaggregate the data, when you begin to unpack these national success cases, we actually see a very different story. Take Chile, for example. Chile is hailed around the world as being a national success in improving maternal child health. And in the aggregate, it did improve maternal child health over baseline. Now, if you begin to cut this data in different ways, if you begin to disaggregate it, say, by region, and you look at the regions inside Chile, 47% of those regions did improve in terms of maternal child health outcomes. But 41% of those regions actually got worse. Of the countries that improved maternal child health outcomes, 2/3 of them posted growing levels of inequality, the inference being that there are many who are left behind. Anthony Lake, who heads UNICEF, has said that our national success cases are masking moral and practical failures because people are being left behind. Now, who are these people? The data tells us that these people are those who are the poorest of the poor, those who are living in a slum, maybe those who are living far off in the countryside, women and children, disproportionately girls, indigenous populations, the culturally marginalized, and so on. These are the people being left behind. The question is, why are they being left behind? They're being left behind because they're hard to reach. And they're hard to reach because they are, for all intents and purposes, invisible. Consider, for instance, that until very recently, 50% of India's population, about 650 million people, did not have any form of identification. Consider in slums, which are by definition an illegal settlement, there are no addresses. Consider, for instance, that in the global south, the vast majority of workers work in the informal sector. They're irregular wage earners, they're agricultural or seasonal wage earners, they work under the table, they work for contracts. In India, for instance, 92% of workers, if you include agricultural workers, are informally employed. Only 1 of 10 work in the formal labor sector. Now consider that as of 2013, UNICEF estimates that 230 million children around the world under the age of 5, that's 1/3 of the world's children under the age of 5, did not have their births registered, which means they likely don't have a birth certificate, which means they are then shut out of health and education services, and they are vulnerable to human atrocities such as human trafficking. These children are children I met when I was doing some work in Ethiopia. In all likelihood, their births were not registered. In all likelihood, they don't have a birth certificate because the birth registration rate in Ethiopia is 7%. So this is the kind of work that I'm doing in my own research lab. The REACH project here at the Munk School of Global Affairs at the University of Toronto is looking at cases around the world, trying to understand how we can reach those who are hardest to reach. And we have research sites in Rwanda, Thailand, India, South Africa, Brazil, and in Jordan. And we've learned a lot through our research. We've learned that there are some really cool technological innovations that are being used to reach the hardest to reach. So mobile technology as a platform for financial inclusion that is now getting people in both the cities and in the countryside into the banking sector. Drones that are delivering things to far-off places. We have a project in Jordan in which iris scan technologies are used to ensure cash transfers. Satellite imaging, providing geocodes or geotags in lieu of an address for those who are living in slums. A lot of cool technological stuff that you might read in Wired magazine or that my colleagues here at U of T are working on are reaching the hardest to reach. We're also learning, however, there is a lot of not so cool but equally effective ways in which we're reaching the hardest to reach. In Brazil, for instance, to deliver cash transfers to those living in the Amazon rim, they use a boat. And there's an ATM machine that goes upriver and delivers cash. In Brazil, there is the Cadastro Único, which is a registry in which all low-income households are registered. And on that line where you're supposed to put your address, if you live in a favela and you don't have an address, you can say that I live in so-and-so favela, 4th lane, 3rd alley, past the Loteria house, past the latrine, 2nd door, red door on your right. That's the kind of precision that we're uncovering in how people are reaching the hardest to reach. We've had teams shadowing mobile units when people get in vans and drive literally hours to ensure that children are having their births registered. And we've shadowed community health workers who are literally pounding the pavement, knocking on doors, making sure that families are sending their kids to school, that their children are receiving their vaccines, or that they're receiving their cash transfer. The key point I'm trying to make here is that we need to reach the hardest to reach, and to reach the hardest to reach means that we can't simply be doing more of the same. The MDGs were a great era. It helped us reduce poverty, but if we want to eliminate poverty, we can't be doing more of the same. We need some innovative thinking. We need to reach the hardest to reach, but we also need to want to reach the hardest to reach. And that's a political question. That's a reflection of political will. But the problem is that reaching the hardest to reach is expensive. To reach voters in the Leh district in the northern mountains of India, to reach those 140 voters to register them costs $1,600 US per voter, likely 3 times more than what that person earns in a year. Because you have to get on a plane, get in a truck, pay for the fuel, ride camels, hike overnight in order to reach that person who is hard to reach. Sending cash up the Amazon means you have to have a boat. The boat has to be secured. You have to pay for fuel all the time in order to deliver those cash transfers to people living in the jungles. Here in Canada, we know that food prices in northern Canada are 5 or 6 times higher than what we pay here in Toronto. And it shouldn't come as a surprise that 50% of Indigenous children suffer from food insecurity. Now, the issue is not the cost of the intervention itself, because after all, a cash transfer in Sao Paulo is the same as a cash transfer in the Amazon Rim. Just as the intrinsic value of a bunch of grapes here in Toronto is the same as the value of a bunch of grapes in northern Canada. It's not the cost of the intervention itself that's expensive, it's delivering that intervention that's expensive. It's reaching the hardest to reach that is expensive. So the idea that we are going to experience the economies of scale as we expand out, whereby things get cheaper, is simply not true. In fact, in our research, what we're finding is that the marginal cost of reaching the hardest to reach increases the further out you go. From an economic point of view, this is dollars and cents. This is expressed as cost. From a political point of view, this is about redistribution. The redistribution of resources from the haves to the have-nots. Now, as a political scientist, I could tell you a few things about the politics of redistribution. The haves don't tend to like to redistribute resources to the have-nots. The very poor tend not to politically mobilize because, frankly, they have more important things to do, like getting their next meal on the table. And 3, it's generally not politically worthwhile for governments to reach the hardest to reach. So, what do we know then? We know that it's imperative to reach the hardest to reach. We know it's very difficult to reach those who are hard to reach, and we know it's very expensive to reach those that are hard to reach, but we have to do all of that if we want to achieve the Sustainable Development Goals. What we need is disruptive development. And this is what we're doing in the REACH lab here at the University of Toronto. We're uncovering what we see to be the ingredients of disruptive development. What are some of these ingredients? First, solutions over technology. We need to find solutions. Technology is a phenomenal enabler, but we don't push the technologies unless they are solving a problem. Second, politics is just as important, if not more important, than dollars and cents, because if we don't have the political will, we're never going to reach the hardest to reach. And third, reality. Boots on the ground. Seeing with your own eyes, smelling with your own noses, hearing with your own ears is how we're going to generate solutions more than any of the theories that we're going to write and transcribe here at the university. And this is where you come in, the disruptive generation. The work that I'm doing with my students, and we have students from across the University of Toronto working in this lab. My students tell me that the SDGs is their generation's calling. They tell me it's their generation's responsibility. The MDGs were mine, the SDGs are theirs. And I'm really optimistic. I have seen extraordinary commitment on the part of these young people in recognizing this to be their generation's calling. I have been told by these young people that they do not see their future life's work in terms of climbing rung after rung up the corporate ladder, but rather moving from project to project, solution to solution. These young people tell me that impact is more important than profit. And indeed, I've seen that for these young people, the world is a much smaller place. Technology has made the world a much smaller place, and empathy has made the world a much smaller place. And so while I may vex, and I will continue to vex about questions like how do we deliver vaccines to children living in a slum, I expect that your generation will not be vexed by these questions, and I look forward to hearing your solutions. Thank you.
Professor Joseph Wong.